Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
When caring for the client diagnosed with delirium, which condition is the most important for the nurse to investigate? 1. Cancer of any kind. 2. Impaired hearing. 3. Prescription drug intoxication. 4. Heart failure. The correct answer is 3. Polypharmacy is much more common in the elderly. Drug interactions increase the incidence of intoxication from prescribed medications, especially with combinations of analgesics, digoxin, diuretics, and anticholinergics. With drug intoxication, the onset of the delirium typically is quick, although cancer, impaired hearing, and heart failure could lead to delirium in the elderly. The onset would be more gradual. With plans to breastfeed her neonate, a pregnant client with insulin-dependent diabetes asks the nurse about insulin needs during the postpartum period. Which of the following statements about postpartum insulin requirements for breastfeeding mothers should the nurse include in the explanation? 1. They fall significantly in the immediate postpartum period. 2. They remain the same as during the labor process. 3. They usually increase in the immediate postpartum period. 4. They need constant adjustment during the first 24 hours. The correct answer is 1. Insulin needs fall significantly for the first 24 hours postpartum because the client has usually been on nothing by mouth status for a period of time during labor, and the labor process has used maternal glycogen stores. If the client breastfeeds, lower blood glucose levels decrease the insulin requirements. With insulin resistance gone, the client commonly needs little or no insulin during the immediate postpartum period. Although the need for insulin decreases during the interpartum period, the insulin requirements fall further during the first 24 hours postpartum. After the first 24 hours postpartum, insulin requirements may fluctuate markedly, needing adjustment during the next few days as the mother's body returns to a non-pregnant state. A client with chronic undifferentiated schizophrenia reports doing very little all day except sleeping and eating. The nurse should 1. Have 3 meals per day brought in to increase the amount of time the client spends out of bed. 2. Ask a relative to call the client at least 10 times a day to decrease the sleeping. 3. Help the client set up a daily activity schedule to include setting a wake-up alarm. 4. Arrange for the client to move to a group home with structured activities. The correct answer is 3. The client with CUS needs more structure every day to improve functioning. Therefore, helping the client to set up a daily activity schedule is most appropriate. However, a group home is not necessary. The client is already eating. Having meals brought in would increase the client's dependence, not his activity level. Asking a relative to call the client 10 times per day is unrealistic given the typical daily responsibilities of a healthy relative. After the birth of a viable neonate, a 20-year-old primiparous client comments to her mother and the nurse about the baby. Which of the following comments would the nurse interpret as a possible sign of potential maternal-infant bonding problems? 1. He's got my funny-looking ears. 2. I think my mother should give him the first feeding. 3. He's a lot bigger than I expected him to be. 4. I want to buy him a blue outfit to wear when we get home. The correct answer is 2. Avoidance, hostility, or low-key passive behavior toward the baby may be a cue to potential bonding problems. The nurse should encourage the client to give the baby the first feeding to begin the bonding process. Expressions of disappointment with the baby's gender may also signal problems with maternal-infant bonding. Comparing the baby's features to her own indicates identification of the neonate as belonging to her, suggesting bonding with neonate. Comparing the actual neonate with the fantasized neonate is a normal maternal reaction. Wanting to buy a blue outfit indicates an interest in and connection with the neonate and is a sign of bonding. Which statement by the client indicates an understanding of the teaching regarding the use of magnesium sulfate and corticosteroids for preterm labor? 1. I will be on magnesium sulfate and corticosteroids until my baby's due date, so he has the best chance of doing well. 2. The magnesium sulfate is to stop contractions while the corticosteroids increase lung surfactant in my baby, so he can breathe better if he is born early. 3. The goal of the magnesium sulfate and the corticosteroids is to stop contractions and help me get to my due date. For if I take this magnesium sulfate and the corticosteroids, my baby won't have to spend any time in the neonatal intensive care unit if he is born. The correct answer is 2. Corticosteroids given IM have been shown to increase fetal lung surfactant and reduce the risk of respiratory distress syndrome in premature infants. It is not a guarantee that a premature newborn would not have problems at birth that would require time in the neonatal intensive care unit. The administration of the corticosteroids is normally completed within 24 to 48 hours. Magnesium sulfate is currently given IV to women in preterm labor to stop contractions and therefore prolong gestation long enough for the corticosteroids to be most effective for the fetus. Magnesium sulfate is not always effective at stopping preterm labor. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client has just had a cesarean section for a prolapsed cord. In reviewing the client's history, which of the following factors places a client at risk for cord prolapse? Select all that apply. 1, -2 station. 2, low birth weight infant. 3, rupture of membranes. 4, breech presentation. 5, prior abortion. 6, low-lying placenta. The correct answers are 1, 2, 3, and 4. Having the fetus at a negative station places a client at risk for a cord prolapse. With a negative station, there is room between the fetal head and the maternal pelvis for the cord to slip through. A small infant is more mobile within the uterus, and the cord can rest between the fetus and the inside of the uterus or below the fetal head. With a large infant, the head is usually in a vertex presentation and occludes the lower portion of the uterus, preventing the cord from slipping by. When membranes rupture, the cord can be swept through with the amniotic fluid. In a breech presentation, the fetal head is in the fundus and smaller portions of the fetus settle into the lower portion of the uterus, allowing the cord to lie beside the fetus. Prior abortion and a low-lying placenta have no correlation to cord prolapse. While caring for a moderately obese prima gravida client in active labor at term, the nurse should monitor the client for signs of which the following: 1, hypotonic reflexes. 2, increased uterine resting tone. 3, soft tissue dystocia. 4, increased fear and anxiety. The correct answer is 3. The obese pregnant client is more susceptible to soft tissue dystocia, which can impede the progress of labor. Symptoms of soft tissue dystocia would include an arrest of labor, prolonged labor, or an arrested descent of the fetus. Hypotonic reflexes are associated with magnesium sulfate therapy, and increased uterine resting tone is associated with hypertonic labor patterns in early labor, not with obesity and pregnancy. Increased fear and anxiety are also not associated with obesity. However, they may be associated with a prima gravida client who does not know what to expect during labor. After undergoing surgical correction of pyloric stenosis, an infant is returned to the room in stable condition. While standing by the crib, the mother says, "Perhaps if I had brought my baby to the hospital sooner, the surgery could have been avoided." Which of the following should be the nurse's best response? 1, surgery is the most effective treatment for pyloric stenosis. 2, try not to worry, your baby will be fine. 3, do you feel that this problem indicates that you are not a good mother? 4, do you think that earlier hospitalization could have avoided surgery? The correct answer is 4. Restating or rephrasing a mother's response provides the opportunity for clarification and validation. It also helps to focus on what the mother is saying and address her concerns and feelings. Although surgery is the most effective treatment for pyloric stenosis, stating this ignores the mother's feelings and does not give her an opportunity to express them. Telling the mother not to worry also ignores the mother's feelings. Additionally, this type of statement gives a mother premature reassurance, which may turn out to be false. Asking the mother if she thinks the problem indicates that she is not a good mother implies such an idea. It does not allow her to express her concerns and feelings, and therefore is not a therapeutic response. After completing diagnostic testing, the surgeon has scheduled a newborn with a diagnosis of an imperforate anus for surgery the next day. The infant's parents are Catholic and do not want the surgery to take place unless the infant has first been baptized. The nurse asks the parents, 1. Are you worried your baby might die? 2. Do you want me to help arrange the baptism? 3. Do you want to speak with a social worker? 4. Would you prefer to wait for the surgery? The correct answer is 2. The nurse should honor the parent's belief system and help arrange to have the infant baptized. This may be done through the hospital's chaplaincy department or by the family's clergy. The parents may indeed be worried that the infant may die during surgery. Having the infant baptized would help address the family's spiritual needs. At this time, there is an immediate need for chaplaincy, not social service. While surgery may be postponed briefly, the infant cannot begin feeding until an outlet for stool has been established. Therefore, it is not advisable to postpone the surgery for a prolonged period of time. Which of the following measures will be most effective in helping the infant with a cleft lip and palate to retain oral feedings? 1. Burp the infant at frequent intervals. 2. Feed the infant small amounts at one time. 3. Place the end of the nipple far to the back of the infant's tongue. 4. Maintain the infant in a lying position while feeding. The correct answer is 1. An infant with a cleft lip and palate typically swallows large amounts of air while being fed and therefore should be burped frequently. The soft palate defect allows air to be drawn into the pharynx with each swallow formula. The stomach becomes distended with air, and regurgitation, possibly with aspiration, is likely that the infant is not burped frequently. Feeding frequently, even in small amounts, would not prevent swallowing of large amounts of air. A nipple placed in the back of the mouth is likely to cause the infant to gag and aspirate. Holding the infant in a lying position during feedings can also lead to regurgitation and aspiration of formula. The infant should be fed in an upright position. A confused client with carbon monoxide poisoning experiences dizziness when ambulating the bathroom. The nurse should 1. Put all 4 side rails up on the bed. 2. Ask the unlicensed personnel to place restraints on the client's upper extremities. 3. Request that the client's roommate put the call light on when the client is attempting to get out of bed. 4. Check on the client at regular intervals to ascertain the need to use the bathroom. The correct answer is 4. Confusion and vertigo are risk factors for falls. Measures must be taken to minimize the risk of injury. The nurse or unlicensed personnel should check on the client regularly to determine needs regarding elimination. Restraints, including bed rails and extremity restraints, should be used only to ensure the person's safety or the safety of others, and there must be a written prescription from a physician before using them. The nurse should never ask the roommate of a client to be responsible for the client's safety. A client with acute respiratory distress syndrome is on a ventilator. The client's peak inspiratory pressures and spontaneous respiratory rate are increasing, and the PO2 is not improving. Using S-bar communication, the nurse calls a physician with a recommendation for 1. Initiating IV sedation. 2. Starting a high-protein diet. 3. Providing pain medication. 4. Increasing the ventilator rate. The correct answer is 1. The client may be fighting the ventilator breaths. Sedation is indicated to improve compliance with the ventilator in an attempt to lower peak inspiratory pressures. The workload of breathing does indicate the need for increased protein calories. However, this will not correct the respiratory problems with high pressures and respiratory rate. There is no indication that the client is experiencing pain. Increasing the rate on the ventilator is not indicated with the client's increased spontaneous rate. Which of the following is a realistic short-term goal to be accomplished in 2 to 3 days for a client with delirium? 1. Explain the experience of having delirium. 2. Resume a normal sleep-wake cycle. 3. Regain orientation to time and place. 4. Establish normal bowel and bladder function. The correct answer is 3. In approximately 2 to 3 days, the client should be able to regain orientation and thus become oriented to time and place. Being able to explain the experience of having delirium is something that the client is expected to achieve later in the course of the illness, but ultimately before discharge. Resuming a normal sleep-wake cycle and establishing normal bowel and bladder function probably will take longer, depending on how long it takes to resolve the underlying condition. The nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategies is likely to be the least beneficial for the client population? 1. Teaching independent living skills. 2. Assisting clients with living arrangements. 3. Helping clients in insight-oriented therapy. 4. Linking clients with community resources. The correct answer is 3. Insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychosocial rehabilitation program involves teaching the client to live independently by using interpersonal skills and community resources. Before placing the fetal monitoring device on a prima gravida client's fundus, the nurse performs Leopold's maneuvers. When performing the third maneuver, the nurse explains that this maneuver is done for which of the following reasons. 1. To determine whether the fetal presenting part is engaged. 2. To locate the fetal cephalic prominence. 3. To distinguish between a breech and a cephalic presentation. 4. To locate the position of the fetal arms and legs. The correct answer is 1. Leopold maneuvers are performed to determine the presentation and position of the fetus. The third maneuver determines whether the fetal presenting part is engaged in the maternal pelvis. The first maneuver distinguishes between a breech and a cephalic presentation through palpation of the top of the fundus. The second maneuver locates the fetal back, arms, and legs. The fetal heart rate monitoring device should be placed near the fetal skull and back for optimal fetal heart rate monitoring. The fourth maneuver is done to locate the fetal cephalic prominence if the fetus is in a cephalic position. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 27-year-old prima gravida client with insulin-dependent diabetes at 34 weeks gestation undergoes a non-stress test, the results of which are documented as reactive. The nurse should tell the client that the test results indicate which of the following? 1. A contraction stress test is necessary. 2. The non-stress test should be repeated. 3. Chorionic villus sampling is necessary. 4. There is evidence of fetal well-being. The correct answer is 4. The non-stress test is considered reactive when 2 or more fetal heart rate accelerations of at least 15 BPM occur, along with fetal movement, during a 10 to 20-minute period. A reactive non-stress test indicates fetal heart rate accelerations and well-being. There is no indication for further evaluation. However, contraction stress tests are commonly scheduled for pregnant clients with insulin-dependent diabetes in the latter part of pregnancy and are repeated periodically until birth. Chorionic villus sampling is usually performed early in the pregnancy to detect fetal abnormalities. A 77-year-old client is brought to the emergency department by her son. The client has severe headache and lack of sleep because I'm so worried about everything. Her son says that she has heart failure and chronic schizophrenia. In addition to all of her heart medicines, she is on aripiprazole, which was increased to 30 milligrams by her family doctor 3 days ago. In addition to documenting all the client's medications and exact dosages, the nurse should particularly investigate which of the following? Select all that apply. 1. The qualifications of the client's primary care provider. 2. The client's symptoms of schizophrenia. 3. The dose of aripiprazole. 4. The client's symptoms of heart failure. 5. The client's relationship with her son. The correct answers are 2, 3, 4. The client's symptoms are likely to be adverse effects of aripiprazole, especially at the reported dose. The normal adult dose is 5 to 10 milligrams. The elderly client commonly needs a lower dose compared with other adults. The anxiety and sleep disturbance could be symptoms of schizophrenia or medication adverse effects. A holistic approach would include assessing the client's heart failure. Questioning the qualifications of the family doctor is unproductive. There are no indications of problems in the client's relationship with her son. The nurse is performing effleurage for a prima gravida client in early labor. The nurse should do which of the following? 1. Deep kneading of superficial muscles. 2. Secure grasping of muscular tissues. 3. Light stroking of the skin surface. 4. Prolonged pressure on specific sites. The correct answer is 3. Light stroking of the skin, or effleurage, is commonly used with the Lamaze method of childbirth preparation. Light abdominal massage with just enough pressure to avoid tickling is thought to displace the pain sensation during a contraction. Deep kneading and secure grasping are typically associated with relaxation massages to relieve stress. Prolonged pressure on specific sites is associated with acupressure. Which statements by the mother of a toddler should lead the nurse to suspect that the child is at risk for iron deficiency anemia? Select all that apply. 1. He drinks over 3 cups of milk per day. 2. I can't keep enough apple juice in the house. He must drink over 10 ounces per day. 3. He refuses to eat more than 2 different kinds of vegetables. 4. He doesn't like meat, but he will eat small amounts of it. 5. He sleeps 12 hours every night and takes a 2-hour nap. The correct answers are 1 and 2. Toddlers should have between 2 and 3 cups of milk per day and 8 ounces of juice per day. If they have more than that, then they are probably not eating enough other foods, including iron-rich foods that have the needed nutrients. Food preferences vary among children. It is acceptable for the child to refuse foods as long as the diet is balanced and contains adequate calories. The child is obtaining a normal amount of sleep. The primary healthcare provider prescribes 1,000 milliliters of Ringer's lactate intravenously over an 8-hour period for a 29-year-old prima gravida client at 16 weeks gestation with hyperemesis. The drip factor is 12 drops per milliliter. The nurse should administer the IV infusion at how many drops per minute? Blank drops per minute. The correct answer is 25 drops per minute. The formula is set up as 12 drops over 1 milliliter times 1,000 milliliter over 8 hours times 1 hour over 60 minutes. You multiply everything and you get 12,000 over 480. You divide 12,000 by 480 and you get 25 drops per minute. When developing a plan of care for a neonate who was diagnosed with an anorectal malformation and who subsequently underwent surgery, which of the following would be most helpful in facilitating parent-infant bonding? 1. Explaining to the parents that they can visit at any time. 2. Encouraging the parents to hold their infant. 3. Asking the parents to help monitor the infant's intake and output. 4. Helping the parents plan for their infant's discharge. The correct answer is 2. Encouraging the parents to hold their neonate promotes parent-infant attachment. Parent-infant bonding is based on a relationship that begins when the parent first touches the infant. Both the parents and the infant have predictable steps that they go through in this process. Explaining that the parents can visit at any time promotes bonding only if they do visit with, talk to, and hold the newborn. Asking the parents to help monitor intake and output at this time may be too anxiety-producing, thus interfering with bonding. Helping the parents plan for the infant's discharge involves them in the newborn's care and is important. However, it is not the first step in the development of bonding. After teaching the parents of a neonate diagnosed with a tracheoesophageal fistula about this anomaly, the nurse determines that the teaching was successful when the father describes a condition as which of the following? 1. The muscle below the stomach is too tight, causing the baby to vomit forcefully. 2. There is a blind upper pouch and an opening from the esophagus into the airway. 3. The lower bowel is lacking certain nerves to allow normal function. 4. A part of the bowel is on the outside without anything covering it. The correct answer is 2. Although a TEF can include several different structural anomalies, The most common type involves a blind upper pouch and a fistula from the esophagus into the trachea. Other types include a blind pouch at the end of the esophagus with no connection to the trachea and a normal trachea, and esophagus with an opening that connects them. A tightened muscle below the stomach and projectile vomiting of normal amounts of formula are characteristic of pyloric stenosis. A ganglionic megacolon is a lack of autonomic parasympathetic ganglion cells in a portion of the lower intestine. Gastroschisis occurs when the bowel herniates through a defect in the abdominal wall and no membrane covers the exposed bowel. Which of the following individuals has the highest priority for receiving seasonal influenza vaccination? 1. A 60-year-old man with a hiatal hernia. 2. A 36-year-old woman with 3 children. 3. A 50-year-old woman caring for a spouse with cancer. 4. A 60-year-old woman with osteoarthritis. The correct answer is 3. Individuals who are household members or home care providers for high-risk individuals are high-priority targeted groups for immunization against influenza to prevent transmission to those who have a decreased capacity to deal with the disease. The wife who is caring for a husband with cancer has the highest priority of the clients described because her husband is likely to be immunocompromised and particularly susceptible to the flu. A healthy 60-year-old man or a healthy 36-year-old woman is not in a high-priority category for influenza vaccination. A 60-year-old woman with osteoarthritis does not have a higher priority for influenza vaccination than a home care provider. Which of the following conditions can place a client at risk for acute respiratory distress syndrome? 1. Septic shock. 2. Chronic obstructive pulmonary disease. 3. Asthma. 4. Heart failure. The correct answer is 1. The 2 risk factors most commonly associated with the development of ARDS are gram-negative septic shock and gastric content aspiration. Nurses should be particularly vigilant in assessing a client for onset of ARDS if the client has experienced direct lung trauma or a systemic inflammatory response syndrome, which can be caused by any physiologic insult that leads to widespread inflammation. Chronic obstructive pulmonary disease, asthma, and heart failure are not direct causes of ARDS. The nurse has calculated a low PaO2/FiO2 ratio less than 150 for a client with acute respiratory distress syndrome. The nurse should place the client in which position to improve oxygenation, ventilation distribution, and drainage of secretions? 1. Supine. 2. Semifowlers. 3. Lateral side. 4. Prone. The correct answer is 4. Prone positioning is used to improve oxygenation in clients with ARDS who are receiving mechanical ventilation. The positioning allows for recruitment of collapsed alveolar units, improvement in ventilation, reduction in shunting, mobilization of secretions, and improvement in functional reserve capacity. When the client is supine, side-to-side repositioning should be done every 2 hours with the head of the bed elevated at least 30 degrees. On arrival at the emergency department, a client tells a nurse that she suspects that she may be pregnant but has been having a small amount of bleeding and has severe pain in the lower abdomen. The client's blood pressure is 70/50 and her pulse rate is 120 beats per minute. The nurse notifies the primary healthcare provider immediately because of the possibility of 1. Ectopic pregnancy. 2. Abruptio placentae. 3. Gestational trophoblastic disease. 4. Complete abortion. The correct answer is 1. The client's signs and symptoms indicate a probable ectopic pregnancy, which can be confirmed by ultrasound examination or by cholecystosis. The primary healthcare provider is notified immediately because hypovolemic shock may develop without external bleeding. Once the fallopian tube ruptures, blood will enter the pelvic cavity, resulting in shock. Abruptio placentae would be manifested by a board-like uterus in the 3rd trimester. Gestational trophoblastic disease would be suspected if the client exhibited no fetal heart rate and symptoms of pregnancy-induced hypertension before 20 weeks gestation. A client with complete abortion would exhibit a normal pulse and blood pressure with scant vaginal bleeding. A client admitted with a diagnosis of schizoaffective disorder, manic phase, who is currently taking fluoxetine, valproic acid, and olanzapine prescribed has had an increase in manic symptoms in the past week. The psychiatrist prescribes a valproic acid blood level to be drawn at once. The nurse understands the rationale for this prescription, as which of the following? 1. All clients taking valproic acid need periodic valproic acid levels drawn. 2. Fluoxetine can decrease the effectiveness of the valproic acid. 3. A decrease in the level of valproic acid could explain the increase in manic symptoms. 4. The valproic acid level is needed before a short course of lorazepam for agitation can be prescribed. The correct answer is 3. Valproic acid is commonly used to treat manic symptoms. Therefore, a decrease in the valproic acid level could explain the increase in manic symptoms. Periodic determinations of the valproic acid level are necessary to determine the effectiveness of the drug. However, the stat nature of the specimen to be drawn indicates an immediate problem. Fluoxetine is not known to decrease the effectiveness of valproic acid. The valproic acid level is not needed before beginning a short course of therapy with lorazepam. The primary healthcare provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as a purpose? 1. Assessment of the fetal hematocrit level. 2. Increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. Pressure is applied with the fingers to the fetal scalp through the dilated cervix. This should cause a tactile response in the fetus and increase the fetal heart rate and variability. However, if the fetus is in distress and becoming acidotic, fetal heart rate acceleration will not occur. The fetal hematocrit level can be measured by fetal blood sampling. Scalp stimulation does not increase the strength of the contractions. However, it can increase fetal heart rate and variability. Fetal position is assessed by identifying skull landmarks during a vaginal examination. A multigravida client at 34 weeks gestation with premature rupture of the membranes tests positive for group B streptococcus. The client is having contractions every 4 to 6 minutes. Her vital signs are as follows: blood pressure 120/80, temperature 100 degrees Fahrenheit, pulse 100 beats per minute, respirations 18 breaths per minute. Which of the following would the nurse expect a primary healthcare provider prescribe? 1. Intravenous penicillin. 2. Intravenous gentamicin sulfate. 3. Intramuscular betamethasone. 4. Intramuscular cefaclor. The correct answer is 1. Because group B streptococcus is a gram-positive bacterium, the primary healthcare provider probably will prescribe intravenous penicillin to treat the mother's infection and prevent fetal infection. Gentamicin sulfate, which acts on gram-negative bacteria, would be inappropriate. Administering a corticosteroid, such as betamethasone, is inappropriate because the premature rupture of the membranes enhances fetal lung maturity. The lack of amniotic fluid causes early maturation of lung tissue. Cefaclor, which is available only in the oral form, is used for upper and lower respiratory tract infections and urinary tract infections by gram-negative staphylococci. The nurse is planning care for a group of pregnant clients. Which of the following clients should be referred to a healthcare provider immediately? 1. A woman who is at 10 weeks gestation, is having nausea and vomiting, and has +1 ketones in her urine. 2. A woman who is at 37 weeks gestation and has insulin-dependent diabetes, experiencing 2 to 3 hyperglycemic episodes weekly. 3. A woman at 32 weeks gestation and is preeclamptic with +3 proteinuria. 4. A woman at 15 weeks gestation who reports she has not felt fetal movement. The correct answer is 3. The nurse should refer the preeclamptic client with 3+ proteinuria to a healthcare provider. The 3+ urine is significant, indicating there is much protein circulating. The woman who is 37 weeks gestation with insulin-dependent diabetes who has experienced hypoglycemic episodes in the past week can be managed with food and glucose tablets until the client can obtain an appointment with the care provider. The client at 10 weeks gestation with nausea and vomiting and +1 ketones should also be seen by a healthcare provider. But at this point, this client is uncomfortable, but her life is not in danger. The 15-week client would not be expected to feel her baby move as soon in the pregnancy, and this would not be considered a problem that requires immediate referral to a healthcare provider. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 24-year-old prima gravida client who gives birth to a viable term neonate is prescribed to receive oxytocin intravenously after delivery of the placenta. Which of the following signs would indicate to the nurse that the placenta is about to be delivered? 1. The cord lengthens outside the vagina. 2. There is decreased vaginal bleeding. 3. The uterus cannot be palpated. 4. Uterus changes to discoid shape. The correct answer is 1. The most reliable sign that the placenta has detached from the uterine wall is lengthening of the cord outside the vagina. Other signs include a sudden gush of vaginal blood. Usually, when placenta detachment occurs, the uterus becomes more firm and changes in shape from discoid to globular. This process takes about 5 minutes. If the placenta does not separate, manual removal may be necessary to prevent postpartum hemorrhage. The nurse explains to the parents of a 1-year-old child admitted to the hospital in sickle cell crisis that the local tissue damage the child has on admission is caused by which of the following? 1. Autoimmune reaction complicated by hypoxia. 2. Lack of oxygen in the red blood cells. 3. Obstruction to circulation. 4. Elevated serum bilirubin concentration. The correct answer is 3. Characteristic sickle cells tend to cause log jams in capillaries. This results in poor circulation to local tissues, leading to ischemia and necrosis. The basic defect in sickle cell disease is an abnormality in the structure of the red blood cells. The erythrocytes are sickle-shaped, rough in texture, and rigid. Sickle cell disease is an inherited disease, not an autoimmune reaction. Elevated serum bilirubin concentrations are associated with jaundice, not sickle cell disease. A newborn admitted with pyloric stenosis is lethargic and has poor skin turgor. The primary care provider has prescribed IV fluids of dextrose water with sodium and potassium. The baby's admission potassium level is 3.4 milliequivalents per liter. The nurse should 1. Notify the primary care provider. 2. Administer the prescribed fluids. 3. Verify that the infant has urinated. 4. Have the potassium level redrawn. The correct answer is 3. Normal serum potassium levels are 3.5 to 4.5 milliequivalents per liter. Elevated potassium levels can cause life-threatening cardiac arrhythmias. The nurse must verify that the client has the ability to clear potassium through urination before administering the drug. Infants with pyloric stenosis frequently have low potassium levels due to vomiting. A level of 3.4 milliequivalents per liter is not unexpected and should be corrected with the prescribed fluids. The lab value does not need to be redrawn, as the findings are consistent with the infant's condition. A newborn who had a surgical repair of a tracheoesophageal fistula is started on oral feedings. Which of the following should the nurse include in the teaching plan for the mother about oral feedings? 1. They are better tolerated when larger, but less frequent feedings are offered. 2. They should be offered on a feeding schedule to help the infant accept the feedings more readily. 3. They are best accepted by the infant when offered by the same nurse or by the infant's mother. 4. They are best planned in conjunction with observations of the infant's behavior. The correct answer is 4. When initiating oral feedings after surgical repair of a TEF, it is best to follow a plan of care in conjunction with observation of the infant's needs and behavior. When the infant's needs and behavior are overlooked, plans are likely to be unsatisfactory and are more likely to meet the nurse's needs rather than the infant's needs. After a surgical procedure, infants initially tolerate small amounts of fluids offered more frequently better than larger amounts offered less often. Smaller amounts cause less bloating as the infant becomes used to feeding again. Although infants accept feedings more readily from their mother or from someone who feeds the infant repeatedly, the priority is to meet the infant's nutritional needs based on the infant's behavior. When developing a plan of care for an infant with a cleft lip before corrective surgery is performed, which of the following should be a priority? 1. Maintaining skin integrity in the oral cavity. 2. Using techniques to minimize crying. 3. Altering the usual method of feeding. 4. Preventing the infant from putting fingers in the mouth. The correct answer is 3. Before corrective surgery for a cleft lip, the infant needs to consume formula or breast milk. Methods for feeding may need to be adjusted to fit the infant's needs because the infant with a cleft lip experiences a decreased ability to suck, which interferes with the infant's ability to compress the nipple. A special feeder may be used to feed the infant to ensure adequate caloric intake. Problems with infection and skin integrity in the mouth are uncommon because the areas of the defect are not open areas. Although crying may cause the infant to swallow more air because of the defect, crying poses no harm to the infant. There is no need to keep the infant's fingers out of the mouth preoperatively. The fingers will not harm the defect or cause an infection. A client is admitted to the emergency department with a headache, weakness, and slight confusion. The physician diagnoses carbon monoxide poisoning. What should the nurse do first? 1. Initiate gastric lavage. 2. Maintain body temperature. 3. Administer 100% oxygen by mask. 4. Obtain a psychiatric referral. The correct answer is 3. Carbon monoxide poisoning develops when carbon monoxide combines with hemoglobin. Because carbon monoxide combines more readily with hemoglobin than oxygen does, tissue anoxia results. The nurse should administer 100% oxygen by mask to reduce the half-life of carboxyhemoglobin. Gastric lavage is used for ingested poisons. With tissue anoxia, metabolism is diminished with a subsequent lowering of the body's temperature. Thus, steps to increase body temperature will be required. Unless the carbon monoxide poisoning is intentional, a psychiatric referral would be inappropriate. A client with acute respiratory distress syndrome is showing signs of increased dyspnea. The nurse reviews a report of blood gas values that recently arrived. Shown below, pH is 7.35, PaCO2 is 25, HCO3 is 22 milliequivalents per liter, and PaO2 is 95. Which findings should the nurse report to physician? 1. pH. 2. PaCO2. 3. HCO3. 4. PaO2. The correct answer is 2. The normal range for PaCO2 is 35 to 45. Thus, this client's PaCO2 level is low. The client is experiencing respiratory alkalosis due to hyperventilation. The nurse should report this finding to the physician because it requires intervention. The increase in ventilation decreases the PaCO2 level, which leads to decreased carbonic acid and alkalosis. The bicarbonate level is normal in uncompensated respiratory alkalosis, along with the normal PaO2 level. Normal serum pH is 7.35 to 7.45 in uncompensated respiratory alkalosis. The serum pH is greater than 7.45. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. Potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all of the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. The son of an elderly client who has cognitive impairments approaches a nurse and says, "I'm so upset." The primary healthcare provider says, "I have 4 days to decide on where my dad is going to live." The nurse responds to the son's concerns, gives him a list of types of living arrangements, and discusses the needs, abilities, and limitations of the client. The nurse should intervene further if the son makes which comment. 1. Boy, I have a lot to think about before I see the social worker tomorrow. 2. I think I can handle most of Dad's needs with the help of some home health care. 3. I'm so afraid of making the wrong decision, but I can move him later if I need to. 4. I want the social worker to make this decision so Dad won't blame me. The correct answer is 4. Expecting the social worker to make the decision indicates that the son is avoiding participating in decisions about his father. The other responses convey that the son understands the importance of a careful decision, the availability of resources, and the ability to make new plans if needed. When teaching a prima gravida client with diabetes about common causes of hyperglycemia during pregnancy, which of the following would the nurse include? 1. Fetal macrosomia. 2. Obesity before conception. 3. Maternal infection. 4. Pregnancy-induced hypertension. The correct answer is 3. Maternal infection is the most common cause of maternal hyperglycemia and can lead to ketoacidosis, coma, and death. The client should notify the primary healthcare provider immediately if she experiences symptoms of an infection. Fetal macrosomia, obesity before conception, and pregnancy-induced hypertension are not associated with maternal hyperglycemia during pregnancy. The plan of care for an outpatient client with chronic undifferentiated schizophrenia includes risperidone therapy. The nurse prepares to administer this drug based on the understanding of which of the following? 1. The positive symptoms of CUS are usually more prominent than the negative symptoms. 2. Agranulocytosis is less of a risk with risperidone therapy than with clozapine. 3. Traditional antipsychotics help with negative symptoms, but not as well as Risperdal does. 4. Risperidone is less expensive than traditional antipsychotics. The correct answer is 2. With CUS, negative symptoms are more prominent. Therefore, risperidone is given to help control negative symptoms. Negative symptoms do not respond to traditional antipsychotics, such as Haldol or Thorazine. Agranulocytosis is commonly associated with clozapine. Because it is a newer drug, risperidone usually is more expensive than traditional antipsychotics. Which of the following would be the priority when caring for a prima gravida client whose cervix is dilated at 8 centimeters when the fetus is at 1+ station and the client has had no analgesia or anesthesia? 1. Giving frequent sips of water. 2. Applying extra blankets for warmth. 3. Providing frequent perineal cleansing. 4. Offering encouragement and support. The correct answer is 4. The client is in the transition phase of the first stage of labor. During this phase, the client needs encouragement and support because this is a difficult and painful time when contractions are especially strong. Usually, the client finds it difficult to maintain self-control. Everything else seems secondary to her as she progresses into the second stage of labor. Although ice chips may be given, typically the client does not desire sips of water. Labor is hard work. Generally, the client is perspiring and does not desire additional warmth. Frequent perineal cleansing is not necessary unless there is excessive amniotic fluid leaking. The mother tells the nurse she will be afraid to allow her child with hemophilia to participate in sports because of the danger of injury and bleeding. After explaining that physical fitness is important for children with hemophilia, which of the following activities should the nurse suggest as ideal? 1. Snow skiing. 2. Swimming. 3. Basketball. 4. Gymnastics. The correct answer is 2. Swimming is an ideal activity for a child with hemophilia because it is a non-contact sport. Many non-contact sports and physical activities that do not place excessive strain on joints are also appropriate. Such activities strengthen the muscles surrounding joints and help control bleeding in these areas. Non-contact sports also enhance general mental and physical well-being. Falls and subsequent injury to the child may occur with snow skiing. Basketball is a contact sport and therefore increases the child's risk for injury. Gymnastics is a very strenuous sport. Gymnasts frequently have muscle and joint injuries that result in bleeding episodes. The nurse is working with 4 clients on the obstetrical unit. Which client will be the highest priority for a cesarean section? 1. Client at 40 weeks gestation, whose fetus weighs 8 pounds by ultrasound estimate. 2. Client at 37 weeks gestation with fetus in right occiput posterior position. 3. Client at 32 weeks gestation with fetus in breech position. 4. Client at 38 weeks gestation with active herpes lesions. The correct answer is 4. Herpes simplex virus can be transmitted to the infant during a vaginal birth. The neonatal effects of herpes are severe enough that a cesarean birth is warranted if active lesions, primary or secondary, are present. A client with a primary infection during pregnancy sheds the virus for up to 3 months after the lesion has healed. The client carrying an infant weighing 8 pounds will be given a trial of labor before cesarean. The client with a fetus in the right occiput posterior position will have a slow labor with increased back pain, but can give birth vaginally. The fetus in the breech position still has many weeks to change positions before being at term. At 7 months gestation, the breech position is not a concern. The nurse is managing care of a prima gravida at full term who is in active labor. What should be included in developing the plan of care for this client? 1. Oxygen saturation monitoring every half hour. 2. Supine positioning on back, if it is comfortable. 3. Anesthesia/pain level assessment every 30 minutes. 4. Vaginal bleeding, rupture of membrane assessment every shift. The correct answer is 3. The nurse should monitor anesthesia/pain levels every 30 minutes during active labor to ascertain that this client is comfortable during the labor process, and particularly during active labor when pain often accelerates for the client. When in active labor, oxygen saturation is not monitored unless there is a specific need, such as heart disease. The client should not be on her back, but wedged to the right or left side to take the pressure off the vena cava. When lying on the back, the fetus compresses the major blood vessels. Vaginal bleeding in active labor should be monitored every 30 minutes to 1 hour. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The father of a neonate scheduled for gastrointestinal surgery asked the nurse how newborns respond to painful stimuli. Which of the following should be the nurse's best response? 1. Newborns cry and cannot be distracted to stop crying. 2. When faced with the pain, newborns try to roll away from it. 3. Newborns typically move their whole body in response to pain. 4. Pain causes a newborn to withdraw the affected part. The correct answer is 3. The neonate responds to pain with total body movement and brief, loud crying that ceases with distraction. After the age of 6 months, an infant reacts to pain with intense physical resistance and tries to escape by rolling away. A toddler reacts to pain by withdrawing the affected part. The parents of a child with a tracheoesophageal fistula express feelings of guilt about their baby's anomaly. Which of the following approaches by the nurse would best support the parents? 1. Helping the parents accept their feelings as a normal reaction. 2. Explaining that the parents did nothing to cause the newborn's defect. 3. Encouraging the parents to concentrate on planning their baby's care. 4. Urging the parents to visit their newborn as often as possible. The correct answer is 1. The parents of children born with defects often have feelings of guilt and ask what they might have done to cause a condition or how they might have avoided it. It is important to allow parents to express their feelings and to accept these feelings as normal reactions. Explaining that the parents are not at fault would not be appropriate until they have dealt with their feelings of guilt. Encouraging long-term planning generally is of little benefit to parents who are emotionally distraught. Additionally, the parents may interpret this as ignoring their feelings and confirming that they played a role in causing their child's anomaly. Urging the parents to visit their infant as often as possible would generally be of little help and could appear to the parents as though they are being talked out of their feelings. A nurse received the taped change of shift report for assigned clients and prioritizes client rounds. In what order should the nurse assess these clients? 1. A client with an endotracheal tube transferred out of the intensive care unit that day. 2. A client with type 2 diabetes who had a cerebrovascular accident 4 days ago. 3. A client with cellulitis of the left lower extremity with a fever of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. 4. A client receiving D5WIV at 125 milliliters per hour with 75 milliliters remaining. The correct order is 1, 3, 4, and 2. Because two major complications of endotracheal tube intubation, inadvertent extubation, and aspiration, can be catastrophic events, assessment of this client is a first priority. Cellulitis is a serious infection as there is inflammation of subcutaneous tissues. Third spacing of fluid may promote the formation of a fluid volume deficit, which can be exacerbated by the fever due to insensible fluid loss. The nurse should assess this client next to determine current vital signs and fluid status. The nurse should assess the client with the IV fluids next because the new bag of fluids will need to be hung in 30 to 40 minutes. IV therapy necessitates that the client be assessed for signs and symptoms of adequate hydration, and the IV access site needs to be assessed. From the information provided, there is no indication that the client who had the cerebrovascular accident is unstable. Thus, this client is the last priority for assessment. Which of the following interventions should the nurse anticipate in a client who has been diagnosed with acute respiratory distress syndrome? 1. Tracheostomy. 2. Use of a nasal cannula. 3. Mechanical ventilation. 4. Insertion of a chest tube. The correct answer is 3. Endotracheal intubation and mechanical ventilation are required in ARDS to maintain adequate respiratory support. Endotracheal intubation, not a tracheostomy, is usually the initial method of maintaining an airway. The client requires mechanical ventilation. Nasal oxygen will not provide adequate oxygenation. Chest tubes are used to remove air or fluid from intrapleural spaces. The nurse has placed the intubated client with acute respiratory distress syndrome in prone position for 30 minutes. Which of the following would require the nurse to discontinue prone positioning and return the client to the supine position? Select all that apply. 1. The family is coming in to visit. 2. The client has increased secretions requiring frequent suctioning. 3. The SpO2 and PO2 have decreased. 4. The client is tachycardic with drop in blood pressure. 5. The face has increased skin breakdown and edema. The correct answers are 3, 4, and 5. The prone position is used to improve oxygenation, ventilation, and perfusion. The importance of placing clients with ARDS in prone positioning should be explained to the family. The positioning allows for mobilization of secretions, and the nurse can provide suctioning. Clinical judgment must be used to determine the length of time in the prone position. If the client's hemodynamic status, oxygenation, or skin is compromised, the client should be returned to the supine position for evaluation. Facial edema is expected with the prone position, but the skin breakdown is a concern. A 69-year-old client is admitted and diagnosed with delirium. Later in the day, he tries to get out of the locked unit. He yells, "Unlock this door. I've got to go see my doctor. I just can't miss my monthly Friday appointment." Which of the following responses by the nurse is most appropriate? 1. Please come away from the door. I'll show you your room. 2. It's Tuesday and you are in the hospital. I'm a nurse. 3. The door is locked to keep you from getting lost. 4. I want you to come eat your lunch before you go to the doctor. The correct answer is 2. Loss of orientation, especially for time and place, is common in delirium. The nurse should orient the client by telling him the time, date, place, and who the client is with. Taking the client to his room and telling him why the door is locked does not address his disorientation. Telling the client to eat before going to the doctor reinforces his disorientation. A prima gravida client with diabetes at 39 weeks gestation is seen in the high-risk clinic. The primary healthcare provider estimates that the fetus weighs at least 4,500 grams. The client asks, what causes a baby to be so large? The nurse's response is based on the understanding that fetal macrosomia is usually related to which of the following? 1. Family history of large infants. 2. Fetal anomalies. 3. Maternal hyperglycemia. 4. Maternal hypertension. The correct answer is 3. Maternal hyperglycemia and poor control of the mother's diabetes mellitus have been implicated in fetal macrosomia. When the mother is hyperglycemic, large amount of amino acids, free fatty acids, and glucose are transferred to the fetus. Although maternal insulin does not cross the placenta, the fetal pancreas responds by hypertrophy of the islet cells of the pancreas. The islet cells produce large amounts of insulin, which acts as a growth hormone. A family history of large infants usually is not the reason for large for gestational age fetuses in diabetic mothers. Maternal hypertension is associated with small for gestational age fetuses because of vasoconstriction of the maternal and placental blood vessels. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening. A primiparous client has just given birth. The primary healthcare provider has informed the labor nurse that he believes the uterus has inverted. Which of the following would help to confirm this diagnosis? Select all that apply. 1. Hypotension. 2. Gush of blood from the vagina. 3. Intense, severe, tearing type of abdominal pain. 4. Uterus is hard and in a constant state of contraction. 5. Inability to palpate the uterus. 6. Diaphoresis. The correct answers are 1, 2, 5, and 6. Uterine inversion is indicated by a sudden gush of blood from the vagina, leading to decreased blood pressure and an inability to palpate the uterus, since it may be in or protruding from the vagina, and any signs of blood loss, such as diaphoresis, paleness, or dizziness could be observed at this time. Intense pain and a hard contracting uterus are not associated with uterine inversion. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following? 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Prematurity is associated with RDS because of the immaturity of the fetal lungs. RDS is not a result of indomethacin. Hyperbilirubinemia is more common in preterm infants. Use of indomethacin to halt preterm labor is not associated with cardiomyopathy in the infant. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first: 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on cord. Enabling perfusion to the infant, turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. Assessment of a prima gravida client in active labor who has had no analgesia or anesthesia reveals complete cervical effacement, dilation of 8 centimeters, and the fetus at 0 station. The nurse should expect the client to exhibit which of the following behaviors during this phase of labor? 1. Excitement. 2. Loss of control. 3. Numbness of the legs. 4. Feelings of relief. The correct answer is 2. Assessment findings indicate that the client is in the transition phase of labor. During this phase, it is not unusual for clients to exhibit a loss of control or irritability. Leg tremors, nausea, vomiting, and urge to bear down also are common. Excitement is associated with the latent phase of labor. Numbness of the legs may occur when epidural anesthesia has been given. However, it is rare when no anesthesia is given. Feelings of relief generally occur during the second stage, when the client begins bearing down efforts. The nurse is assisting with conscious sedation for a 6-year-old undergoing a bone marrow biopsy. The nurse's most important responsibility during the procedure is to 1. Administer the topical anesthetic. 2. Keep the parents informed. 3. Monitor the client. 4. Record the procedure. The correct answer is 3. During conscious sedation, the client may lose protective reflexes, and adequate respiratory and cardiac function may be impaired. At every procedure, there must be one healthcare professional whose sole responsibility is to monitor the client. Topical agents must be given in advance of the procedure to be effective. During the procedure, the nurse would not leave the child to speak with parents. While the procedure will be documented according to the facility's protocols, proper monitoring of the client is the intervention most associated with reducing risks. Which of the following beverages should the nurse plan to give a child with leukemia to relieve nausea? 1. Orange juice. 2. Weak tea. 3. Plain water. 4. A carbonated beverage. The correct answer is 4. Carbonated beverages ordinarily are the best tolerated when a child feels nauseated. Many children find cola drinks especially easy to tolerate, but non-cola beverages are also recommended. Orange juice usually is not tolerated well because of its high acid content. Tea may also be too acidic, and many children do not like tea. Water does not relieve nausea. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following complications? 1. Emboli formation. 2. Fluid volume overload. 3. Red blood cell hemolysis. 4. Allergic reaction. The correct answer is 2. Too rapid infusion of blood or any intravenous fluid can cause fluid volume overload and related problems such as pulmonary edema. Emboli formation, red blood cell hemolysis, and allergic reaction are not related to rapid infusion. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following should be readily available at the bedside of the client with a chest tube in place? 1. A tracheostomy tray. 2. Another sterile chest tube. 3. A bottle of sterile water. 4. A spirometer. The correct answer is 3. A bottle of sterile water should be readily available and in view when a client has a chest tube, so that the tube can be immediately submersed in the water if the chest tube system becomes disconnected. The chest tube should be reconnected to the water seal system as soon as a sterile functioning system can be reestablished. There is no need for a tracheostomy tray, another chest tube, or a spirometer to be placed at the bedside for emergency use. Which of the following would be a significant intervention to help prevent lung cancer? 1. Encourage cigarette smokers to have yearly chest radiographs. 2. Instruct people about techniques for smoking cessation. 3. Recommend that people have their houses and apartments checked for asbestos leakage. 4. Encourage people to install central air filters in their homes. The correct answer is 2. Epidermoid cancer involving the larger bronchi is almost entirely associated with heavy cigarette smoking. The American and Canadian Cancer Societies report that smoking is responsible for more than 80% of lung cancers in men and women. The prevalence of lung cancer is related to the duration and intensity of the smoking. So nurses can best prevent lung cancer by persuading clients to stop smoking. Chest radiographs aid in detection of lung cancer. They do not prevent it. Exposure to asbestos has been implicated as a risk factor for lung cancer. But cigarette smoking is the major risk factor. There are no data to support the use of home air filters in the prevention of lung cancer. A multigravida client diagnosed with probable ruptured ectopic pregnancy is scheduled for emergency surgery. In addition to monitoring the client's blood pressure before surgery, which of the following would the nurse assess? 1. Uterine cramping. 2. Abdominal distension. 3. Hemoglobin and hematocrit. 4. Pulse rate. The correct answer is 4. Fallopian tube rupture is an emergency situation because of extensive bleeding into the peritoneal cavity. Shock soon develops if precautionary measures are not taken. The nurse readying a client for surgery should be especially careful to monitor blood pressure and pulse rate for signs of impending shock. The nurse should be prepared to administer fluids, blood, or plasma expanders as necessary to an intravenous line that should already be in place. Because the fertilized ovum has implanted outside the uterus, uterine cramping is unlikely. However, abdominal tenderness or knife-like pain may occur. Abdominal fullness may be present, but abdominal distension is rare unless peritonitis has developed. Although the hemoglobin and hematocrit may be checked routinely before surgery, the laboratory results may not truly reflect the presence or degree of acute hemorrhage. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population? 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care, is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities. The nurse assesses a primiparous client with ruptured membranes in labor for 20 hours. The nurse identifies late decelerations on the monitor and initiates standard procedures for the labor client with this wave pattern. Which interventions should the nurse perform? Select all that apply. 1. Administering oxygen via mask to the client. 2. Questioning the client about the effectiveness of pain relief. 3. Placing the client on her side. 4. Readjusting the monitor to a more comfortable position. 5. Applying an internal fetal monitor. The correct answers are 1, 3, and 5. Decelerations alert the nurse that the fetus is experiencing decreased blood flow from the placenta. Administering oxygen will increase tissue perfusion. Placing the mother on her side will increase placental perfusion and decrease cord compression. Using an internal fetal monitor would help in identifying a possible underlying cause of the decelerations, such as metabolic acidosis. Assessing for pain relief and readjusting the monitor would have no effect on correcting the late decelerations. A client with gestational diabetes who is entering her 3rd trimester is learning how to monitor her fetus's movements. After teaching the client about the kick count, the nurse should provide further instruction if the client makes which of the following statements? 1. The baby may be more active at different times of the day. 2. How I feel my baby move is different than my friend. 3. The baby should be moving less than 10 times in 2 hours. 4. The baby may not move at times because it is asleep. The correct answer is 3. Feeling 4 kicks in 30 minutes or feeling 10 or more kicks in 2 hours are norms. Fetuses are more active at various times of the day, particularly after mother has eaten when the blood glucose level is high, and in the evening. Each individual perceives their fetus to move differently. Fetuses do sleep several times per day for about 30 minutes each time. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which the following: 1. Apathy, affect, social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. Which of the following would the nurse include in the teaching plan for a 16-year-old prima gravida client in early labor concerning active relaxation techniques to help her cope with pain? 1. Relaxing uninvolved body muscles during uterine contractions. 2. Practicing being in a deep meditative, sleep-like state. 3. Focusing on an object in a room during contractions. 4. Breathing rapidly and deeply between contractions. The correct answer is 1. Childbirth educators use various techniques and methods to prepare parents for labor and birth. Active relaxation involves relaxing uninvolved muscle groups while contracting a specific group and using chest breathing techniques to lift the diaphragm off the contracting uterus. A deep meditative, sleep-like state is a form of passive relaxation. Focusing on an object in the room is part of Lama's technique for distraction. Breathing rapidly and deeply can lead to hyperventilation and is not recommended. A mother asks the nurse if her child's iron deficiency anemia is related to the child's frequent infections. The nurse responds based on the understanding of which of the following? 1. Little is known about iron deficiency anemia and its relationship to infection in children. 2. Children with iron deficiency anemia are more susceptible to infection than are other children. 3. Children with iron deficiency anemia are less susceptible to infection than are other children. 4. Children with iron deficiency anemia are equally as susceptible to infection as are other children. The correct answer is 2. Children with iron deficiency anemia are more susceptible to infection because of marked decreases in bone marrow functioning with microcytosis. A multigravida client is admitted at 16 weeks gestation with a diagnosis of hyperemesis gravidarum. The nurse should explain to the client that hyperemesis gravidarum is thought to be related to high levels of which of the following hormones? 1. Progesterone. 2. Estrogen. 3. Somatotropin. 4. Aldosterone. The correct answer is 2. Although the cause of hyperemesis is still unclear, it is thought to be related to high estrogen and human chorionic gonadotropin levels or to trophoblastic activity or gonadotropin production. Hyperemesis is also associated with infectious conditions such as hepatitis or encephalitis, intestinal obstruction, peptic ulcer, and hydatidiform mole. Progesterone is a relaxant used during pregnancy and would not stimulate vomiting. Somatotropin is a growth hormone used in children. Aldosterone is a male hormone. A 12-year-old with leukemia will be taking vincristine. The nurse should encourage the child to eat what kind of diet? 1. High residue. 2. Low residue. 3. Low fat. 4. High calorie. The correct answer is 1. Vincristine may cause constipation, so the client should be encouraged to eat a high residue diet. The other diets do not help with constipation that can occur while receiving vincristine. A 15-year-old has been admitted to the hospital with a diagnosis of acute lymphocytic leukemia. Which of the following signs and symptoms require the most immediate nursing intervention? 1. Fatigue and anorexia. 2. Fever and petechiae. 3. Swollen neck lymph glands and lethargy. 4. Enlarged liver and spleen. The correct answer is 2. Fever and petechiae associated with acute lymphocytic leukemia indicate a suppression of normal white blood cells and thrombocytes by the bone marrow and put the client at risk for other infections and bleeding. The nurse should initiate infection control and safety precautions to reduce these risks. Fatigue is a common symptom of leukemia due to red blood cell suppression. Although the client should be told about the need for rest and meal planning, such teaching is not the priority intervention. Swollen glands and lethargy may be uncomfortable, but they do not require immediate intervention. An enlarged liver and spleen do require safety precautions that prevent injury to the abdomen. However, these precautions are not the priority. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water-sealed chest tube drainage system. The nurse notes that the fluid in the water-seal column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water seal column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water seal column. Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The director of a workshop program tells a nurse that the client with schizophrenia had done well for 6 months until last week when a new person started at the workshop. This new person worked faster than the client did and took his place as leader of the group. Based on this information, which of the following interventions is most appropriate? 1. Make a home visit and tell the client that if he does not return to the workshop, he will lose his place there. 2. Ask the director to assign the client to another work group when he returns to the workshop. 3. Make an appointment to meet the client at the mental health center and ask him about the situation. 4. Arrange the placement of the client in a skill training program. The correct answer is 3. The most therapeutic action at this time is for the nurse to make an appointment with the client at the mental health center to explore his feelings and behavior. Doing so acknowledges the client's importance and makes him a partner in resolving the problem. The nurse needs to determine what is going on in the situation first, and then plan accordingly. Threatening the client with loss of position, asking for a new assignment for the client, or arranging for the placement of the client in a skill training program is inappropriate and premature. The stigma related to having a mental illness, especially a chronic illness, persists despite improvements in the management of illnesses and an increase in public education. Which of the following views most perpetuates the stigma? 1. Mental illness is hereditary. 2. Mental illnesses have biochemical bases. 3. Clients cannot prevent mental illness if they want to do so. 4. Clients can recover from mental illness if they have willpower. The correct answer is 4. Many still believe that recovery from mental illness is a matter of willpower. For example, pull yourself up by your bootstraps or just get over it. This belief persists despite awareness that mental illness is hereditary and has a biochemical basis. Mental illness can be prevented only if there is early intervention. Clients cannot prevent it just by the desire to do so. A 30-year-old multigravid client at 8 weeks gestation has a history of insulin-dependent diabetes. Since age 20, when explaining about the importance of blood glucose control during pregnancy, the nurse should tell the client that which of the following will occur regarding the client's insulin needs during the first trimester. 1. They will increase. 2. They will decrease. 3. They will remain constant. 4. They will be unpredictable. The correct answer is 2. During the first trimester, it is not unusual for insulin needs to decrease, commonly as a result of nausea and vomiting. Progressive insulin resistance is characteristic of pregnancy, particularly in the second half of pregnancy. It is not unusual for insulin needs to increase by as much as 4 times the non-pregnant dose after about the 24th week of gestation. This resistance is caused by the production of human placental lactogen, also called human chorionic somatotropin, by the placenta and by other hormones, such as estrogen and progesterone, which are insulin antagonists. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking, and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait, asking another staff member to stay with the client, or saying nothing is not helpful. The primary healthcare provider prescribes an amniocentesis for a prima gravida client at 35 weeks gestation in early labor to determine fetal lung maturity. Which of the following is an indicator of fetal lung maturity? 1. Amount of bilirubin present. 2. Presence of red blood cells. 3. Bar body determination. 4. Lecithin sphingomyelin. The correct answer is 4. To determine fetal lung maturity, the sample of amniotic fluid will be tested for the L/S ratio. When fetal lungs are mature, the ratio should be 2:1. Bilirubin indicates hemolysis and, if present in the fluid, suggests Rh disease. Red blood cells should not appear in the amniotic fluid because their presence suggests fetal bleeding. Bar body determination is a chromosome analysis of the sex chromosomes that is sometimes used when a child is born with ambiguous genitalia. A diagnosis of hemophilia A is confirmed in an infant Which of the following instructions should the nurse provide to parents as the infant becomes more mobile and starts to crawl? 1. Administer 1/2 of a children's aspirin for a temperature higher than 101 degrees Fahrenheit. 2. Sew thick padding into the elbows and knees of the child's clothing. 3. Check the color of the child's urine every day. 4. Expect the eruption of the primary teeth to produce moderate to severe bleeding. The correct answer is 2. As the hemophilic infant begins to acquire motor skills, the risk of bleeding increases because of falls and bumps. Such injuries can be minimized by padding vulnerable joints. Aspirin is contraindicated because of its antiplatelet properties, which increase the infant's risk for bleeding. Because genitourinary bleeding is not a typical problem in children with hemophilia, urine testing is not indicated. Although some bleeding may occur with tooth eruption, it does not normally cause moderate to severe bleeding episodes in children with hemophilia. After dilation and curettage to evacuate a molar pregnancy, assessing the client for signs and symptoms of which of the following will be most important? 1. Urinary tract infection. 2. Hemorrhage. 3. Abdominal distension. 4. Chorioamnionitis. The correct answer is 2. After dilation and curettage to evacuate a molar pregnancy, the nurse should assess the client's vital signs and monitor for signs of hemorrhage, because a surgical procedure may have traumatized the uterine lining, leading to hemorrhage. Urinary tract infections, not common after evacuation of a molar pregnancy, are most commonly related to urinary catheterization. Typically, urinary catheters are not used during evacuation of a molar pregnancy. The client should not experience abdominal distension because the contents of the uterus have been removed. Chorioamnionitis is an inflammation of the amniotic fluid membranes. With complete mole, no embryonic or fetal tissue or membranes are present. The nurse is transferring a child who has had open heart surgery from the intensive care unit to the pediatric unit. The child's blood pressure has been fluctuating but has been stable during the last 2 hours. The nurse from the pediatric intensive care unit should include which of the following information in the report to the nurse on the pediatric unit? Select all that apply. 1. Medications being used. 2. Current vital signs. 3. Potential for blood pressure to drop. 4. Drip rate for the intravenous infusion. 5. Time of the most recent dose of pain medication. 6. Medications given during surgery. The correct answers are 1, 2, 3, 4, and 5. The report made when nurses are handing off a client from one nursing unit to another must include information about the condition of the client, potential for changes in client's condition, current medications, and care and services received. It is not necessary to know what medications were given in surgery to provide safe care at this point. Which of the following medication prescriptions to help relieve discomfort in a child with leukemia should the nurse question? 1. Hydromorphone. 2. Acetaminophen with codeine. 3. Ibuprofen. 4. Acetaminophen with hydrocodone. The correct answer is 3. Ibuprofen prolongs bleeding time and is contraindicated in clients with leukemia. Non-narcotic drugs other than ibuprofen or aspirin, such as acetaminophen, may be prescribed to control pain and may be used in combination with codeine or hydrocodone if pain is more severe. Hydromorphone may also be used for severe pain. A client has been in an automobile accident and the nurse is assessing the client for possible pneumothorax. The nurse should assess the client for 1. Sudden sharp chest pain. 2. Wheezing breath sounds over affected side. 3. Hemoptysis. 4. Cyanosis. The correct answer is 1. Pneumothorax signs and symptoms include sudden, sharp chest pain, tachypnea, and tachycardia. Other signs and symptoms include diminished or absent breath sounds over the affected lung, anxiety, and restlessness. Breath sounds are diminished or absent over the affected side. Hemoptysis and cyanosis are not typically present with a moderate pneumothorax. The nurse is preparing to assist with the removal of a chest tube. Which of the following is appropriate at the site from which the chest tube is removed? 1. Adhesive strip. 2. petroleum gauze. 3. 4x4 gauze with antibiotic ointment. 4. No dressing is necessary. The correct answer is 2. Gauze saturated with petroleum is placed over the site to make an airtight seal to prevent air leakage during the healing process. Dressings with antibiotic ointment or adhesives are not used. After thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from the trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis, and also helps force air and fluid out of pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. A 36-year-old multigravida client is admitted to the hospital with possible ruptured ectopic pregnancy. When obtaining the client's history, which of the following will be most important to identify as a predisposing factor? 1. Urinary tract infection. 2. Exercise during pregnancy. 3. Episodes of pelvic inflammatory disease. 4. Use of estrogen-progestin contraceptives. The correct answer is 3. Anything that causes a narrowing or constriction in the fallopian tubes, so that a fertilized ovum cannot be properly transported to the uterus for implantation predisposes an ectopic pregnancy. Pelvic inflammatory disease is the most common cause of constricted or narrow tubes. Developmental defects are other possible causes. Ectopic pregnancy is not related to urinary tract infections. Exercise during pregnancy is not associated with ectopic pregnancy. Progestin-only contraceptives and intrauterine devices have been associated with ectopic pregnancy. When developing the collaborative plan of care with the healthcare provider for a multigravida client at 10 weeks gestation with a history of cardiac disease who was being treated with digitalis therapy before this pregnancy, the nurse should instruct the client about which of the following regarding the client's drug therapy regimen. 1. Need for an increased dosage. 2. Continuation of the same dosage. 3. Switching to a different medication. 4. Addition of a diuretic to the regimen. The correct answer is 2. Unless the client has cardiac decompensation during the pregnancy, she will most likely be able to continue taking the same dose of medication. The client may be prescribed prophylactic antibiotics, particularly if she has had rheumatic fever. The medication will be switched only if digitalis toxicity occurs. A diuretic is added only if congestive heart failure is not controlled by sodium and activity restrictions. For the client with catatonic behaviors, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? 1. The client can move all extremities occasionally. 2. The client walks with the nurse to the client's room. 3. The client responds to verbal directions to eat. 4. The client initiates simple activities without directions. The correct answer is 4. Although all the actions indicate improvement, the ability to initiate simple activities without directions indicates the most improvement in the catatonic behaviors. Moving all extremities occasionally, walking with the nurse to the client's room, and responding to verbal directions to eat represent single steps toward the client initiating her own actions. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. For the past 8 hours, a 20-year-old prima gravida client in active labor with intact membranes has been experiencing regular contractions. The fetal heart rate is 136 BPM with good variability. After determining that the client is still in the latent phase of labor, the nurse should observe the client for 1. Exhaustion, 2. Chills and fever, 3. Fluid overload. For meconium-stained fluid, the correct answer is 1. The normal length of the latent stage of labor in a prima gravida client is 6 hours. If the client is having prolonged labor, the nurse should monitor the client for signs of exhaustion, as well as dehydration. Hypotonic contractions, which are painful but ineffective, may be occurring. Oxytocin augmentation may be necessary. Chills and fever are manifestations of an infection and are not associated with prolonged latent phase of labor. Fluid overload can occur from rapid infusion of intravenous fluids administered if the client is experiencing hemorrhage or shock. It is not associated with prolonged latent phase. The client's membranes are intact, so it would be difficult to assess meconium staining of the fluid. Meconium-stained fluid is associated with fetal distress, and this fetus appears to be in a healthy state, as evidenced by a fetal heart rate within normal range and good variability. When preparing a multigravida client at 34 weeks gestation, experiencing preterm labor for the shake test performed on amniotic fluid, the nurse would instruct the client that this test is done to evaluate the maturity of which of the following fetal systems. 1. Urinary. 2. Gastrointestinal. 3. Cardiovascular. 4. Pulmonary. The correct answer is 4. The shake test helps determine the maturity of the fetal pulmonary system. The test is based on the fact that surfactant foams, when mixed with ethanol, the more stable the foam, the more mature the fetal pulmonary system. Although the shake test is inexpensive and provides rapid results, problems have been noted with its reliability. Therefore, the lecithin-sphingomyelin ratio is usually determined in conjunction with the shake test. A client at 4 weeks postpartum tells a nurse that she can't cope any longer and is overwhelmed by her newborn. The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. A prima gravida client is admitted as an outpatient for an external cephalic version. The nurse should assess the client for which of the following contraindications for procedure. 1. Multiple gestation. 2. Breech presentation. 3. Maternal Rh-negative blood type. 4. History of gestational diabetes. The correct answer is 1. External cephalic version is the turning of the fetus from a breech position to the vertex position to prevent the need for cesarean birth. Genital pressure is used to rotate the fetus in a forward direction to a cephalic lie. Contraindications to the procedure include multiple gestation because of the potential for fetal injury or uterine injury, severe oligohydramnios, contraindications to a vaginal birth, and unexplained third trimester bleeding. If the mother has Rh-negative blood type, the procedure can be performed and Rh immunoglobulin should be administered in case minimal bleeding occurs. A history of gestational diabetes is not a contraindication unless the fetus is large for gestational age and the client has cephalopelvic disproportion. Which of the following should the nurse include when completing discharge instructions for the parents of a 12-month-old child diagnosed with Kawasaki disease and being discharged home? 1. Offer the child extra fluids every 2 hours for 2 weeks. 2. Take the child's temperature daily for several days. 3. Check the child blood pressure daily until the follow-up appointment. 4. Call the primary healthcare provider if the irritability lasts for 2 more weeks. The correct answer is 2. The child's temperature should be taken daily for several days after discharge because recurrent fever may develop. Offering the child fluids every 2 hours is not necessary. Doing so increases a child's risk for CHF. Checking the child's blood pressure at home usually is not included as part of the discharge instructions because by the time of discharge, the child is considered stable and the risk for cardiac problems is minimal. Most children with KD recover fully. Irritability may last for 2 months after discharge. A 10-year-old with leukemia is taking immunosuppressive drugs. To maintain health, the nurse should instruct the child and parents to 1. Continue with immunizations. 2. Not receive any live attenuated vaccines. 3. Receive vitamin and mineral supplements. 4. Stay away from peers. The correct answer is 2. Children who are immunosuppressed should not receive any live attenuated vaccines. Clients who are immunosuppressed and are given live attenuated vaccines, such as measles, mumps, rubella, and oral polio vaccine, can develop severe forms of the diseases for which they're being immunized, which can result in death. Inactivated vaccines may be given if necessary, but the client is not able to adequately produce needed antibodies, and it is recommended that immunizations be delayed for 3 months after the immunosuppressive drugs have been discontinued. Vitamin and mineral supplements are not normally given in conjunction with immunosuppressive drugs. When the client is immunosuppressed, the client should avoid only persons who have an infection. A 12-year-old with leukemia is receiving cyclophosphamide. The nurse should assess for the adverse effect of 1. Photosensitivity. 2. Ataxia. 3. Cystitis. 4. Cardiac arrhythmias. The correct answer is 3. Cystitis is a potential adverse effect of cyclophosphamide. The client should be monitored for pain on urination. Photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. Continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. When caring for a client with a chest tube and water-sealed drainage system, the nurse should 1. Verify that the air vent on the water-sealed drainage system is capped when the suction is off. 2. Strip the chest drainage tubes at least every 4 hours if excessive bleeding occurs. 3. Ensure that the chest tube is clamped when moving the client out of the bed. 4. Make sure that the drainage apparatus is always below the client's chest level. The correct answer is 4. The drainage apparatus is always kept below the client's chest level to prevent backflow of fluid into the pleural space. The air vent must always be open in the closed chest drainage system to allow air from the client to escape. Stripping a chest tube causes excessive negative intrapleural pressure and is not recommended. Clamping a chest tube when moving a client is not recommended. A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb 1 flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.